Racism impacts everything, and it absolutely impacts the health of Black and Brown Americans in so many ways.
Just recently, the Centers for Disease and Control and Prevention, the CDC, came out and made the statement that racism is a threat to the public health. How does racism impact the health of the public, and what role does racism have in the health that Black people receive or other minorities? And that's for you, Dr. Nicole, and anyone else that may want to answer that.
Yeah, I mean, just like everything else in our society, that, racism impacts everything, and it absolutely impacts the health of Black and Brown Americans in so many ways. Some of the things that we already talked about, if you go back to some of the racist policies, if we look at redlining as an example and how that contributed to Black people not being able to live in nice neighborhoods and how that segregated us into certain communities. And as a result, those communities are resource poor. And so, they're resource poor. So the education system is not good. That's all based, on our taxes, and that's all based on your property taxes. So like it all ties in. So if you have, people disproportionately impacted by that, unable to get quality education, therefore they're going to end up in jobs that are lower paying, which keeps us in poverty disproportionately compared to non-Black individuals. And, also those types of jobs, which we've seen with COVID-19, we are overrepresented in jobs that may not offer health insurance at all, or may offer health insurance plans that the employees can't afford. They may not have sick leave, so that, they aren't able to just take off and go get preventive health care, let alone go to the doctor when they actually have a problem. We also know, unfortunately, that, racism and bias impact the actual care that is delivered. And so, not only do we have all of these systemic factors in play that really prevent Black people from having access to the things that would keep us healthy, but we actually have bias within the healthcare system itself. So there's been studies that have shown that, just as one example, in stroke, there was a study that showed that African Americans who presented to the emergency room with a stroke, meaning they had an actual diagnostic study, a CAT scan or an MRI that showed that they have a stroke, they're less likely to get thrombolytic therapy, which you all may know as clot busters. They were less likely to be seen by a neurologist, and it just goes on and on. We know that, Black women 3 to 4 times more likely to die from pregnancy-related complications despite their education. So a Black woman with a college degree is still more likely to die from pregnancy-related complications than a white woman with a high school diploma. Like, that's just crazy. And so going back to the care disparities, even in pediatrics, my beloved specialty, there are studies that show that kids who presented to the emergency department with appendicitis, Black kids were less likely to get any pain medicine compared to the white kids. And then in the Black kids who had severe pain, they were less likely to be given opioid therapy. And there's so many studies about this. There was a study in 2016 where they actually showed white medical students and residents this list of basically crap, like false biological beliefs, differences between Black and white people. And 50% of them, these are your future doctors. By now, they probably are doctors. 50% of this group endorsed at least one of these false beliefs. Things like our skin is thicker, or our nerve endings are less sensitive. So, you can begin to understand how and why we just continue to have these poor outcomes. Not only is the system stacked against us, but within medicine, yes, there are racist doctors, and more prevalent, there are many doctors who have anti-Black bias, implicit and explicit. And so, when we go to the doctor, we're less likely to be offered some of the therapies that our white colleagues would receive. I attended a conference that I'm sure Dr. Sherry probably attended too, but the National Minority Quality Forum had an amazing conference this week. And they were just talking about, even with diabetes and just, the new technology, isn't even really new anymore, but the ability to monitor your glucose or your blood sugar continuously has been proven to decrease complications from diabetes. And once again, Black people are not being offered this therapy. I think it was something like 15% of people with the glucose, 15% of Black people basically, and like 80% that have received this therapy are white. So even when we have conditions, even when we have complications, even when there are known guidelines to dictate the care that we should receive, we don't get the same care that our white counterparts receive. So that's exactly why racism has been and definitely should be declared a public health crisis. And I guess I'm excited about the fact that we're talking about it more, even outside of these types of circles, and hopefully we will finally begin to take action